Hi everyone, Braden here. Today I want to talk to you about lateral knee pain. That's pain on the outside of your knee. Now if you're experiencing pain on the outside of your knee, this could be down to a few factors. But today I want to explore one of those factors, which could be a tight IT band, along with a tight quad, the vastus lateralis, and the tight TFL. So I just want to make sure we're on the same page. If we're getting knee pain around the outside of the knee here, it could be that we have a tight IT band. Now on my pretty picture here, the IT band is a nice band of fascia that comes down from the TFL muscle up here, right down and joins to the side of the leg. It's nice and smooth. Whereas in reality, this IT band actually comes down and spreads and joins into lots of different fascias down here, which is why it could be more than one thing, if not a collection of things, causing this lateral knee pain. Today I want to show you the modified Ober's test. Now the simple Ober's test, just the Ober's test, is we want to find pelvic neutral where the greater trochanter is above each other. Then we simply lift the leg, bring it behind and drop it down. If we can't do this and the client's leg stays up, this can show that we have a tight IT band. But the modified version is a little bit more advanced than that, and it shows us a little bit more. Okay, so what we're going to do first of all is we're going to get the lower leg into a 90-degree bend. So we're going to bring that in front there, that's for stability. Okay, we're then going to take hold of the ankle and lift the knee. Okay, we want to keep hold of this ankle here like this. We're again going to find pelvic neutral, hold onto this knee and take the leg into extension. While we've got this leg, we're going to ask the client to let go and make it nice and loose. So a negative modified Ober's test should look like this. Fantastic. This just drops, there's no resistance there, and we've got a nice swoop down here where the muscles and the fascia up here just let go, it's lengthened nicely. So my client Emily here does actually suffer with lateral knee pain on her right knee. So let's try this modified Ober's test on her symptomatic side. So we've got the side lying knee in a 90-degree, that's to help support. We're going to take the leg back, we're going to hold onto the ankle and make sure we've got that ankle nice and firm. We're then going to find pelvic neutral, fantastic, hold onto the knee, abduct it and extend it. We've now got this nice and firm here. We're going to ask the client to relax, fantastic, and we're just going to drop it. Try again. We're just going to drop it, fantastic. That there is a positive modified Ober's test. This leg does go further down, but as you can see that causes Emily to roll over and it does bring on a stretch in the TFL up here. So now we know that the lateral knee pain that you might be having could be coming from a tight quad, tight IT band or tight TFL. So what do we do about that? I'm going to give you 3 things to do right now. So the first thing we're going to do is try and stretch that tensor fasciae latae. So find yourself a wall, we're going to lean against the wall with our elbow and we're going to take the symptomatic leg or the leg with the tight IT band over the other leg and rest that on the floor. From here, it's really important that we find pelvic neutral. So we want to make sure we've not got this overarched back and we're tucking the ribs down, okay? And we're lifting the stomach up. So bring that up, elbow on the wall, lean across, take this foot to the other side, and we're going to dip the hip towards the wall. We're going to dip that hip towards the wall. You should feel a nice stretch just in the hip around here. Hold this stretch for around 30 seconds to a minute. If you can't feel it here, have a play with your pelvis, have a play with your ribs. See if you can move into a position where you might be able to feel this stretch. If you can't feel the stretch and you're doing everything right, it might not be the TFL that's tight, it might be something else. The next thing I want you to do is find yourself a ball. We're going to do some soft tissue release on this muscle. We're going to get the ball, either a tennis ball or this is a lacrosse ball, and we're going to pop it on that TFL. Okay, again, we're not looking for bone, we're looking for a nice squishy bit of muscle. Once we've located that bit of muscle, we pop the ball against the wall and we lean into it. Okay, so what we're trying to do here is work this muscle out with the ball. What we can do to make this a little bit more intense is take the leg out, take it to the other side, pop it down. That's going to expose that TFL muscle a little bit more. We just want to rock around and move this ball around that TFL area until it starts to loosen off. Rule of thumb is do it for around 30 seconds to a minute. Find those bits that hurt. Press on those little bits that hurt and make them go away. If we take it too far around the side, we might even be getting some glute medius in there, so that's not a bad thing. The last thing I want you to do is get yourself a foam roller. I prefer the smoother foam rollers as they provide more contact area when we're rolling the muscles. The ones with the big spikes in, they're fantastic for trigger point therapy. So if you're wanting to massage the calves or the hamstrings, those ones with the big spikes in, fantastic work for that. But now what we're aiming to do is massage this vastus lateralis, the quad up the side of the leg. So get your foam roller, pop it just below that hip bone. Lay down on your side, and all we're going to do is bring the other foot in front, so we've got support here and we've got support here. And then what I want you to do is almost roll forward onto it a little bit till you can feel that that's on the side of that quad. Then we're going to roll down to just above the knee and roll back up. Okay, so I've had an extra bit of support here automatically. This is just to allow me to take a little bit more pressure off that quad. If I wanted to add more pressure to this, I could put my other leg on top and roll that up and down like this. So what I'm doing is I'm bending at the hip. I'm flexing at the hip to allow this to roll up. So I'm bringing my knees to my chest and rolling it down. I advise people to usually foam roll for around a minute per muscle, depending on how tight that muscle is, depending on the pain level. So there we have it, guys. That's 3 things you can be doing if you're getting lateral knee pain. Those 3 things are tightness reliefs. So they're there to loosen that muscle off and reduce pain. The overall reason why those 3 things might be getting tight is something we might need to explore at a later date. Guys, if you're experiencing any of these symptoms, please go see your GP first if you're worried about it, just to eradicate any clinical issues that you might be having. If the GP gives you the thumbs up and it says it's just tight muscles, please go ahead and do these 3 things. Thanks very much for watching, guys. If you have liked this video, please consider giving me a thumbs up. Please consider subscribing and hitting the notification bell. This will alert you to the next time I post a video. Thanks again, guys, and I'll see you next time.